Hey guys, thank you so much for coming back to another video. I think I'm gonna call this series my cardiac series, right? Because my first video that I did a few days ago, I can't think of the day, was about cardiac catheterization and heart surgery. One I've had, that was the cardiac catheterization. The other one I'm still pending, to have. I meet my heart surgeon tomorrow. Tomorrow is Monday, May 13th. So I meet him tomorrow, and I guess we're going to discuss that whole thing. And so today is Mother's Day. So I just want to wish everyone out there a happy Mother's Day. Especially all you new moms. Yay. Okay. So in my research of doing this cardiac catheterization and open heart surgery, I realized two things. All the videos on YouTube are of medical professionals, cardiologists, doctors, other medical professionals that talk about the procedure. So if you want to know what a cardiac catheterization is and what's involved, there are 5 million videos on that. This video is about cardiac catheterization, and this brings me to my second point of the two things that I realized. There are no videos of people like me, of patients, people who've actually experienced this, that are telling you their experience. So I figure I'll make one. Why not? I'm a YouTuber. I vlog. This is what video, I don't know, I lost count. I don't know. I've made so many videos in the last 5 months. I literally lost count. But I figured, hey, let me go ahead and make a video and talk about my experience. Plus, too, and it's kind of like therapy, right? They say talking is good, because this thing doesn't really leave your mind. If the doctor tells you, oh, you need to have heart surgery, I assure you that's not going to leave your mind. Maybe you can put it behind somewhere, in the back of your mind somewhere, but it's still there, right? It's like one of those little night lights. Even though it's really low and dim, it's still there, it's still on. So, I mean, this is no joking matter, right? This is pretty serious. We're talking about heart surgery. And in my case, I guess a couple of bypasses. I mean, I don't know officially, but I'll find out tomorrow when I speak with the heart surgeon. So, the part that I have done was called a cardiac catheterization. And what I want to say about that is, and I'm going to tell you my experience in just a moment here, is for me at least, mileage will vary. But for me at least, the bark, which is the actual name in the procedure, is a lot louder than the actual bite, which is the physical procedure itself. So let me explain. So let me just preface it with this. So my cardiologist did not do stenting. He did not remove the blockage. He did not stent. The blockage I have is too great, so therefore I fall into the next category, which is the heart surgery. Now, I'm looking at that as a positive, and I'm going to watch my time, but if I have enough time, I'm going to explain to you why, and if I go over, big deal. So first, my experience. I arrived at the hospital, I believe it was like about 7 a.m., just before 7 a.m., and I would say about 12:30, I'm walking out, and my friend is waiting in the car to pick me up, to take me home. So in the course of from 7 a.m. me arriving at the hospital to get checked in, kind of like a hotel, they get you registered in there, and then the nurse comes out, they take you to the prepping area for the surgery, and then the actual catheterization, I guess surgery, quote unquote, recovery, and then, like I said, by 12:30, I'm walking out of those front doors, those front sliding doors of the hospital. So it doesn't take long. It's definitely an outpatient procedure. Again, mileage may vary. My cardiologist did prepare me that, sometimes they may want to keep you overnight, I guess if there's some complications. But for me, it's exactly the way I described. I checked in. The nurse came to get me, took me into the prep area. As he's speaking to me, he's getting me prepped. So they put the IV in my left arm. They put the leads on my body so they can, monitor all those vitals, and did a blood pressure cuff. And while he's doing all that, he's explaining to me what's going to happen. Now, I would say 95% of what he was telling me I already knew, either from the cardiologist or from my own research, like, Google and obviously watching YouTube. There is one thing either I missed, which I don't think I missed. I just didn't, hear this part. But what he was telling me is once they stent, so once the cardiologist clears out the blockage and he puts that stent in your artery, what he was saying is that because the body, it sends out these platelets, these blood platelets that, clog, or not clog, they clock. Yeah. I hope I'm saying that right. But anyway, if you get a cut, your blood begins to clot. Yeah, clot. That's what I'm looking for, a clot. So you can stop bleeding. So the same thing happens when they put this stent in your artery. And that process that your body is doing, he was saying that you have to be on blood thinners and maybe some other medication, because that natural process, when those platelets come to form that clot, they actually clog up the artery. I mean, how crazy is that? The very procedure you're getting to clear your artery, your body's natural, I guess, defense, whatever, to stop bleeding will reclog that artery. So basically what happens is those platelets form to kind of form a clot, and they keep clotting and clotting and clotting, and you see how I'm getting narrow. So yeah, they actually they fill that artery up so no more blood can go through, and that can cause a heart attack or death. We don't want that. So they have to put you on blood thinners and other medications so that process of clotting does not happen. Now, that in itself is not bad, but what he told me next did kind of concern me. So he was saying for at least a year, I'm going to be on this clotting medication, this blood thinning medication. So he was saying, please be careful. Try not to get into an accident. Try not to cut yourself if you're cooking or food prepping. Just be careful, because he says, because you're on this medication, if you cut yourself or get into an accident and cut yourself, he says, call 911 immediately, because your blood is not going to stop. It's going to keep going out of your body because you're on this medication, so therefore no clotting will take place. So you're just bleeding and bleeding and bleeding. Now, obviously, the hospitals have a procedure for this, but I thought, like, wow, so I can't even get into an accident? Not that I want to, and of course, accidents are highly unpredictable, right? We never know when and where they're going to take place. That's the problem with accidents. We just don't know. You can't schedule an accident, right? So I thought that was kind of interesting, and it did kind of bother me a bit. It's like, geez, what if I do get into an accident? What if I'm outside and, I'm a hiker. You guys know that. I'm also a kayaker. What if this happens when I'm out in the woods? Things happen, right? And it may be a moment or two before I can get some really, immediate medical attention. Anyway, so I thought, that was just good to know. So I'm glad he told me that. By the way, the nurse that I had, I forget his name. I'm really embarrassed, but A+, this guy was awesome. But anyway, from there, they took me into the operating room. So that's about 8:30ish, 9 in that area. And there was 2 additional male nurses. Again, great guys. I can have a beer with these guys. They got me all prepped for surgery. So, I have a little hair on my arm, so they shaved this area. They also prepped my groin area, because I think in the past this was done through the groin, but now they go through your arm. In my case, my right arm or right wrist. But just in case, I guess your artery, if it's too small, they still prep the groin area. So, if you're a little ticklish like me, anyway. And the alcohol they use, it has a dye in it. So for me, it was like a bluish, greenish dye. And all that does is tell the cardiologist what parts of your body have been sterilized. So they just swab you, and they also swab you down there. And it has this, like I said, this dye. For me, it was a blue-greenish color. And this way, the cardiologist knows that that area at least is sterile. There was this, I'm not sure what it was, some box machine, probably some monitor that was above me. I'm not sure what it did, but it was above me. It wasn't maybe about 2 feet between my head and it as I'm on the surgical bed. And they put everything in plastic. I think that's more for, contamination being spread, but also just keep in mind they are going into your artery. So I guess spurting, I don't want to be gross, but spurting can occur. I was awake the whole time. it was explained to me that of the drugs, there's going to be two effects. One of them is going to have a warming sensation. One nurse said it's kind of like a burning sensation, but not quite, more of a deep warm sensation. It'll last about 30 seconds. For me, it was more like 7 or 8 seconds. I don't even think it was 10 seconds, and it was gone. And it wasn't burning. It was like a deep warm sensation kind of going through this area right here. Then it was gone. The other one, and this is the major part for me at least, they told me they're going to give me fentanyl, which you guys know, if that sounds familiar, that's that big opioid drug we hear about in the news. But as my cardiologist said to me, he says, don't worry, this is the medically approved legal version. It's not the street version. He was just having fun with me. But plus two is a one-time use. But after they gave me that, I can tell you firsthand, I see why people get addicted to this stuff like instantly. When they gave it to me, my first words literally were wow. W-O-W. Wow. My first sentence after that first word was, can I have another? And I lie not to you, as God is my witness. Wow. Can I have another? Now, I shouldn't laugh because this is obviously a very serious matter, this opioid addiction. I'm not going to get into that. But, after experiencing that and the fentanyl kicking in, yeah, I see why this is a huge epidemic in the country right now. So if you're on these serious pain medications, be careful, seriously. Because I could see me getting so easily addicted to that drug. And it was just one time, right? In an operating room. I could imagine if this was something that was readily available to me. Not that I'm saying I would take drugs that way, but the sensation, the feeling that drug gave me, I tell you, that was amazing. That's the only way I can describe it as amazing. But again, this is all there to make you comfortable, to keep you comfortable, to calm you down, to keep your anxiety down. That's why they give you these things. After that, to be quite honest, I was awake. I can hear them speaking. They were speaking to me every so often. I did not feel a thing. I did not feel this incision. I did not feel this tube or this wire going up through my artery down into my heart. I didn't feel any of that. I didn't feel the dye being injected so they can get a better picture. All I remember them saying is, okay, how you doing? They check in every so often. And then finally the cardiologist, he said, well, we're going to stop the procedure and I'll bring you up to date when we get you back into the recovery room. That was it. That was, again, mileage will vary, but that was it. I didn't feel anything. I remember most things. I remember them moving me off the surgical table back onto the gurney to wheel me back into recovery. And again, I'm awake. I'm just high. I'm legally high, right? And that's how I describe it, basically. Once the drugs finally, I guess, wore off, which I would say about a half an hour, maybe a little bit more afterwards, the cardiologist came in, he explained to me about the whole heart procedure, like how bad. My blockage was too bad for them to clear out, so they have to do the heart surgery. And then going back to the platelets and the blood clotting and the blood thinners that you got to be on for at least a year or maybe more, the benefit to the heart surgery is I don't have to worry about that. They're simply going to bypass the blockage and reroute, I guess, an artery or two. I'll find all this out tomorrow when I meet with the surgeon. But I just want to do a really quick video from a patient's perspective, from someone who's had a cardiac catheterization, what it was like. Again, mileage may vary. Hopefully, if you're facing this, if it's something that you have to get done, it's being recommended, I would say definitely do it. What do they call it? Non-invasive or invasive? I forget. But anyway, I would say do it. They call it the gold standard. It's worth it. It doesn't take long. You're in and out the hospital that same day in most cases. And they have a very clear picture of what's going on. Heart surgery does bring or raises the anxiety level. I will admit that. But again, they're telling me this is all pretty routine nowadays in 2019. So, but anyhow, I just want to document this, right? I'm a YouTuber, I'm a vlogger. They say content creator. I can sit here and worry and rock back and forth in my chair and go, oh geez, what's going to happen next? Or I can make videos about this. I'm going to document all this for you guys. And if this is something that you have to experience, you're going to experience yourself, you have to go through. I hope my videos are a little bit of help to you. Again, for me, the cardiac catheterization, you know, again, that bark of what it is and what's involved was a lot louder than the actual procedure itself. And I hope that is truly the case for you if you're watching this video right now, today, tomorrow, a year from now. Today is May 12th, it's Mother's Day. I'm pretty healthy. For those of you that don't know, you may look at me and go, no! Guys, I'm 50 years old. On February 17th, I turned 50 years old in 2019. I am 5'0". I am half a century old. I say that proudly because I take good care of myself. I hike, I run, I walk, I kayak, I do, and I don't really belong to a gym. My gym is outdoors. You know, most people my age don't look like me. And when I say that, I don't necessarily mean my skin color. I mean, people always think I'm in my 30s. So thank you for that if you were thinking that. Anyway, guys, I gotta find my lens cap. There it is. See, it says Canon. I don't know if you can see that, but it doesn't matter. I will catch you in the next video. Oh, in my next video, I'm gonna do it right back to back after this one, but they banned me from work. I can't go back to work. I need a doctor's note to go to work. Normally, you need a doctor's note when you're out of work. I need a note to go to work. Go figure. Later, guys. See ya.